Neural tube defect. Definition. Neural tube defect are the congenital malformation of the central nervous system resulting from defective closure of neural tube during embryogenesis between 3 rd 4th week of life. Causes and risk factor. The exact cause of neural tube defect is unknown. But risk factor are folic acid deficiency during first trimester, maternal radiation exposure, use of teratogenic drugs, exposure of chemical A. Spinal cord defects, spina occulta, meningocele, meningomyelose, brain defects, anencephaly, encephalocele. Diagrammatic presentation. Spina bifida occulta, meningocele, myelomeningocele. Spina bifida occulta, it is the mildest form where there is a small gap in the spine but the opening cannot be seen in the back. Brain and spinal cord functions are normal and there is no disabilities. In this tuft of hair can be seen. 2. Spina bifida cystica, it is a more severe form of neural tube defects that cause a visible cyst, fluid-filled sac, on the lower part of the body, lumbosacral region. It consists of 2 types. A. Meningocele. B. Myelomeningocele. Meningocele, it is a sac of fluid not involving the spinal cord that comes out through an opening in the back and involve meninges also. Myelomeningocele, the most severe form, where the meninges, CSF, spinal cord and spinal nerves protrude through an opening. Sign and symptoms. Loss of bladder or bowel control. Partial or complete lack of sensation. Partial or complete paralysis of the legs. Weakness of the hips, legs, or feet of a newborn. Other symptoms may include abnormal feet or legs, such as clubfoot. Build-up of fluid inside the skull, hydrocephalus. Hair present at sacral region. Dimpling of the sacral area. Brain defects. Anencephaly is the absence of a major portion of the brain, skull and scalp that occurs during embryonic development. Infants with this disorder do not survive longer than a few hours or possibly days after. Infants with this disorder do not survive longer than a few hours or possibly days after their birth. Encephalocele. It is a sac-like protrusion of meninges with brain substance, spinal cord with brain tissue. The size may vary from small to as big size of head. Clinical feature. Hydrocephalus. Visual problem. Seizure. Microcephaly. Mental retardation. Diagnostic tests. Ultrasound. Maternal serum alpha-fetoprotein at 16 to 20 weeks. Amniotic alpha-fetoprotein. Amniotic acetylcholinesterase. Management. Medical care. The patient should be positioned in the prone position to prevent pressure on the defect. The newborn with an open NTD should be kept warm and the defect covered with a sterile wet saline dressing. Intravenous antibiotic should be initiated. Surgical AIIMS. Surgical AIIMS. Usually no intervention is required for spina bifida occulta. Surgery is required for spina bifida cystica. Closure of the defect or removal of the sac is done with 24 to 48 hours of birth. Preventions. Advise the mother to take folic acid supplementations, especially in preconception period and in first trimester. Women already had first pregnancy with NTD should take a daily 4 mg tablet of folic acid for at least 1 month before conception and then throughout the first 12 weeks of pregnancy. Genetic counseling or screening.